Okay. Well, first I want to say thanks everyone for coming to this edition of Transplant Talks. My name is Patty Draper. I'm the director of the Transplant Mentors Program at Gift of Life. And I will be kind of conducting some education with everyone about the topics of seeking a living donor and some of the topics that and the obstacles that surround that. I will be keeping an eye on the chat. So if you have any questions, clarification, concerns, what have you, please let me know, and I will try to address them as quickly as I see them. First, I always like to start off with a little bit of education about Gift of Life in general. So Gift of Life is a nonprofit organization that promotes the support, awareness, and success of organ, eye, and tissue donation through education, mentoring, and collaboration with lots of partners throughout the transplant community. Transplant Mentors is one of the two signature programs of Gift of Life, which I'm the director of. And we have the pleasure of offering the insight, education, and support that can only be offered by someone who's been through the process. So as you're learning about living donation or even being a recipient of any sort of donation, please know that we could pair you with someone who could speak to you about their firsthand experience, who has been verified by their home transplant center and trained by the staff at Gift of Life on how to kind of deliver that information and provide the support et cetera, that you may need. So first, just a brief explanation of what is living donation. So most organ donations in the United States occur after an organ donor has died. However, living donation has been around as long as transplant has. So they can come from family, friends, anybody, even a total stranger. I always kind of like to look at the history of living donation. This picture with the 5 gentlemen in it off to the side, those are actually identical twins. That's the first kidney transplant to ever happen in the United States and the first living donor kidney transplant. In 1945, Dr. Joseph Murray transplanted a healthy kidney from Ronald Herrick into his brother Richard, identical twins. He had been suffering from chronic kidney failure for some time. He lived an otherwise very healthy life after the transplant until his death from causes not related to transplant at all. Ronald, his living donor brother, lived for another 56 years after the surgery until his death in 2010. So lots of reason there to feel optimistic for our living donor friends. Also, this other 2 pictures are a living liver donor, actually. A transplant team in Australia started experimenting with the idea of mothers donating to their ill children. So the first time that ever happened in the United States was in July of 1989 at the University of Chicago Medical Center, and they began conducting a series of adult to children transplants. This is the couple with their infant son in 1989. So that center picture is the mother in the operating room, I believe. And then that other picture of the mom kissing the baby, that's right before surgery. Kind of sweet. So thinking about what can be donated, the 3 main things that we see are kidney. An individual can donate 1 of their 2 kidneys to a recipient. Liver, people can donate 1 of their lobes to the recipient. And lung is actually kind of funny because it takes 2 adult donors, and they give, one person gives the left and one person gives the right, and from each person, and they both give it to the recipient. So a person, the intended recipient, still has 2 healthy working lungs, and the donors both have 1. We often hear questions about, can living kidney donors live a healthy life with a single kidney? Studies suggest that people can live a normal, healthy life. Living kidney donors are very carefully screened to ensure they are healthy before living donation can take place. They're encouraged to have regular checkups and follow a healthy lifestyle, and they're given pretty good instructions on how and where to follow up. Similarly, liver donors, they can lead a very healthy life. It's very funny. The liver is a really powerful and interesting organ because it can regenerate. A living liver donor can have a portion of their liver removed, and it will regenerate or grow back within a few months after surgery. While recovery times do vary, obviously, most living liver donors are able to return to their pre-donation lives within a few months, which when you think about it, how much work the liver does, that's a big deal. Donors are required to follow up with the transplant hospital for at least 2 years in the instance of both kidney and liver donation. And also it's important to note that that regeneration that we see in the liver happens for both the recipient and the donor. So, the liver piece that is put into the recipient, it grows as well. So both of them grow to the full size, which is really interesting. Lung lobes, however, do not regenerate, but individuals can donate one lobe of a lung and still remain healthy. As long as they're, keep a good eye on things and again, follow up with the transplant center. For the purposes of this presentation, we're really going to be focusing on kidney donation and liver donation. Living donor lung donation is not as common, and we wanted to be able to address the biggest audiences. So when we think about living donation, it's important to kind of look at the statistics surrounding it. Certainly there has been a slowdown since COVID, but things are picking back up statistically speaking. So in 2022, a record year for kidney transplants and transplants in general, 20,092 kidney transplants, and 5,864 of them, nearly 30%, were from living donors, which when you think about it, 30% of any population pool is really pretty big. But, when we look at the wait list, when I checked it last week, the number I saw on the 10th was 88,728. So again, that's a really big number. So that 20,000 feels like a lot, but when you look at 88,000 people waiting, that's also a really big number. And then when we look at the living liver donation numbers, it's a little bit smaller, probably because not every center does it, but also looking at the numbers surrounding liver, they're quite a bit smaller as well. The liver transplants in the United States last year were 10,415 in 2022, and then living donor livers were 603. The liver wait list remains on the 10th was right around 10,400. So it's nice to see a smaller number, but knowing those are still people waiting for a life-saving surgery. So it's very important that we keep ourselves educated on these things. So the living donor liver, you'll note, is only 6% of all all liver transplants, excuse me. So I think a big reason for that is living donor liver surgeries are very surgically complex, and you need a big team of surgeons to do it. So it is really only done by some of the largest hospitals. And when you look on the Gift of Life website, you'll be able to look on our resource list related to living donors, and you can quickly look up a list of where those hospitals are. In 2022, when we're looking at the numbers in general, there were more than 42,000, nearly 43,000 organ transplants performed in the year. Again, setting an annual record. It's really great to see that happening. Of course, deceased donation continues. It's set a 12-year record trend. So things are headed in the right direction in terms of having enough donors, but we definitely know that there will never be enough. So thinking about living donation, it's important to look at the benefits and the risks, right? So living donor benefits, thinking about the recipient, the person who will be receiving the transplant. A living donor transplant is associated with fewer complications and overall longer survival of the donor organ. It shortens the time on the waiting list for other people in need. When you think about it, you're not just helping one person, you're really helping kind of everyone in the line behind them by taking someone off of the list. So there is a exponential benefit to being a living donor. Also, it just improves the odds of the long-term recovery by allowing the surgery to be performed in where before the condition worsens, when the patient is usually healthier. Some benefits to the donor include really the opportunity to contribute to the recipient's life and the lives of the recipient's loved ones in a very meaningful and lifelong way. In speaking to living donors, many of them are kind of just givers and people who are generous, and the phrase I would hear a lot was, well, I just wanted to help. And so this is kind of the ultimate way to do that. And it allows for the surgery to be scheduled at a time when it's convenient for both the donor and the recipient. So I hear when I would be evaluating living donors, they would say, well, I'm a teacher and I'd really like to do this over summer break. And they would say, no problem, or Christmas break or whatever, as your schedule allows. So there are lots of different types of living donors. I think something we're all familiar with and that the history showed was, between the twin brothers or the mother and child, we know that related living directed donation is very common. It includes healthy blood related relatives. This can be, for the medical professionals that will be working with the patient. This could be brothers, sisters, parents, children, any blood relatives, even so much as aunts and uncles. Non-related directed donation, this would be maybe if you wanted to donate to your spouse, a close friend, coworker, neighbor, other acquaintance, but someone you do know. So these are healthy, unrelated living donors who are maybe emotionally close to the transplanted candidate. And then non-directed, or another term you may hear, is altruistic donation. Those living donors are not related and unknown to the recipient. Altruistic donors make their donation for purely selfless reasons and are sometimes called anonymous donors. Not all altruistic or non-directed donors remain anonymous. Sometimes they meet after transplant. Sometimes even the same hospitalization as the transplant. It's not uncommon. And then, of course, the paired exchange donation or donation change. So these are the kind of things you may see on the news because they're very exciting. So when you look at some of the graphics on the side, there is the pretty straight up, well, I can't donate to my husband, so if you donate to him, I will donate to your cousin. And that all of that legwork and the figuring out of that puzzle is done by the transplant center. They do that on behalf of the patient. And then a kidney donation chain is when maybe two groups of people are not compatible, but if you throw in a third living donor pair and recipient, maybe there's compatibility there. So again, that graphic on the top, I don't believe that's ever been done in liver, but I know it's been done in kidney many times, a kidney donation chain. So that's a really interesting thing that you may see. And now they're doing the chains intra-hospital, so they could happen at more than one transplant center, which is really great. Transplant centers coming together, sharing their data, sharing their living donors to benefit everyone collectively. It's very exciting to observe. Many people are interested in becoming anonymously directed donation, meaning they want to donate to someone, but they don't know the recipient, so they will contact their local organ procurement organization. That's not uncommon. And then they run the person's blood against the match list and start from there. So those are some of the types of living donors. There are as many ways to put that puzzle together as you could imagine. And we'll talk a little bit more about how to kind of get the word out about your need for a living donor organ to a greater pool of people so that maybe you can reach that non-directed or altruistic donation. If someone hears of your story and says, oh gosh, I have been waiting, I've been wondering about that, if that's a good choice for me, and now it's on my radar and I'm going to explore that. So some of the barriers to living donation, the most commonly cited barriers are really just fear of starting that conversation. It feels a little uncomfortable to ask for something so big, being embarrassed maybe, or not knowing who or how to even start. I think one of the biggest things is kind of a lack of knowledge about kidney failure or living donation to even begin to make that educated request. The last thing you want to do when you're asking someone a favor is be vague, not know what it includes. So it's important to, educate yourself before you're asking. And that's something we'll talk a little bit more about. Several studies have cited that participants wanted more educational materials and assistance with their conversation skills. And there are resources out there, and we're going to talk about those. Additionally, requesting peer support was a common ask. The Gift of Life Transplant Mentors Program has a very robust roster of living kidney donors and also living liver donors. It is not uncommon that people who are seeking transplant will maybe want to talk to a living donor before they feel comfortable asking a family member or a friend to participate in living donation. They'd like to speak to someone first, or even if someone is wanting to explore for themselves being a living donor, we can connect them with a living donor so they know they're making the right decision for themselves. We got some really nice materials from our friends over at the National Kidney Foundation, and they wanted us to kind of review some of these things. These are the things they found the most important. So just remembering, you do not have to ask someone to donate. So that maybe is part of a bigger conversation. Instead of asking someone to donate, maybe just telling them and letting them know you're seeking a living donor. That may go a little bit more like, oh, Patty, how are you feeling today? We say, oh, I'm a little worn out from dialysis, just feeling down, tired, but doing okay. And well, Patty, how can I help? Then we say, oh, well, I am looking for a living donor. And so the more you can share your story, whether that's social media, groups, church groups, yard signs, of course, not everyone can do the thing that you kind of see in the news, like a husband takes out a billboard or something, but there are definitely ways to reach a large swath of people. We're very lucky to have the internet in that sense. And then also making sure you're including key information is what they wanted to touch on. What living is like with kidney disease. I don't think a lot of people realize what dialysis means and what an undertaking it is. So if you're sharing that information, make sure that someone understands why you need a transplant. I think there may be some misunderstanding that, oh, well, you can just live forever on dialysis, right? And your life is just as well as it would be with a transplant. And so maybe making sure you're able to speak to that, and making sure that you know who they can contact at your transplant center is also important. Making sure you know how they can get a hold of everyone. And they also have some really good resources for finding a living donor. National Kidney Foundation has a new free program called the Patient Navigator Program to help you write and share your story. So if you are wanting to write it yourself and kind of do a campaign, you can do that through their Kidney Navigator program. And also the Kidney Learning Center, I think, is really great. They have online educational videos delivered by recipients and living donors, so you can really get a lot more information kind of at your own pace there. So the next thing I want to touch on is something that I think is really interesting, is the concept of a living donor champion. In 2012, some brilliant minds at Johns Hopkins University decided that they were curious about something. They were curious about the idea that is a recipient the best person to be asking for a donation, and what are the alternatives? So they proposed the idea of a living donor champion. A living donor champion could be a friend, family member, coworker, or really anybody else who helps you. They offer support, encouragement, and really spread the word as far as they can, letting people know that you need help. I used to joke about this with my patients sometimes when I was a transplant social worker and say, if I needed a transplant, I don't think I would be willing to really be very vocal about it. But I could tell you if my children or my husband needed a transplant, I'm not sure you could get me to stop talking about it. And that's kind of where this concept falls in line with. And luckily, the people over at Johns Hopkins have put a lot of hard work and data into it, so we can prove that that really does work. The main barriers were the comfort in initiating the conversation about transplantation. That increased over time with the living donor champions. Living donor champions provides or get some really extra training, and so we're going to talk about that too. Transplant candidates in general are kind of, their wording was ill-equipped. I don't know if that's the kindest wording, but that they just don't have the tools needed to seek living donors. And so by separating the advocate from the patient, that cleared up a lot of the understandable concerns about initiating conversations. Talking a little bit more about what is a living donor champion. A champion is someone who's ready to take up the charge to teach others. So a living donor champion at many large transplant centers, they have these programs themselves, or you can look again on our resource page and find a self-guided curriculum. So the difference is really that the living donor champion is educated on the disease process that their intended recipient is going through. So they share the patient's personal story and educate others about liver or kidney transplant, living donation, and more. That allows for the patient to focus on their own health. And in this Johns Hopkins study, they showed when they compared two different groups of people, one were using a living donor champion and one group was not. The group that were not using a champion, those 26 people, I believe, they didn't, not a single one of them had a living donor step forward. But of the 28 people in the other pool, people using a living donor champion, at the time the study was published in 2012, over half of them had either already completed living donation or had people in the evaluation phase. So people who had volunteered and gone so far as to start their evaluation, which is a big deal. So thinking about that, it's really the more people you reach, the better. And so a lot of these living donor champion toolkits can help take advantage of that larger audience. And so, in the year, it's not 2012 anymore, but when we're thinking of the year 2023 and thinking of how do we communicate with people, really the primary way we do that is social media. A lot of people find success in social media campaigns. There is a lot of information out there about how to participate in that through Facebook or any other system. But essentially, the first thing you should always do is talk with your transplant program staff about how to tell you or your child's story in a way that is safe, effective, and ethical. So they can guide you in that conversation. And again, you can reference our resource list for more. But you or your child's journey with kidney or liver disease, how the need for a transplant has changed your life, your child's life, or your loved one's life, if you're the champion, a little bit about the recipient's family and what would change in their life after receiving a living donor organ, and then of course whether your family has been tested and perhaps why they can't donate. I think that's a big question when people start asking outside the family. That may not be something that people out and out ask, but they wonder, well, why can't your, if it's your child, why can't one of the parents do it? Or, what's going on there. So being transparent to the degree to which you're comfortable, I think, is good. And then, of course, it's important to kind of share the details, right? What organ is needed, the blood type. And if you are sharing your blood type, then you should also share what blood types the person is compatible with. So what blood types you are seeking would be more important than what blood types the recipient would be. How long the wait might otherwise be without a living donation. Making sure to educate people about the advantages of living donation compared to deceased donation, the state where you live, and then, of course, your transplant center contact. Almost all transplant centers have dedicated employees just for living donation purposes. So that is important, that when you are spreading the word, you're pointing them in the right direction. So whether that's a website, an email address, a phone number, make sure you check with your transplant coordinator to see what the preferred means of communication is for initiating that process. Many transplant centers have kind of a little questionnaire you fill out online, and that kind of gives a lot of information so that when the transplant center calls you back, they have a lot of information already in hand, which is helpful. For many seeking living donation, social media is an excellent tool. It really gets stuff out very simply, quickly, and it's free, which is always wonderful when we think about transplant stuff. There's so many expenses, but kind of publicizing your need for a living donor doesn't have to be expensive. Sharing the story is really such an important piece of that. When I would be evaluating people for transplants, and it was so common for people to say, well, I saw on my Facebook page that this girl I went to high school with, her nephew needs a transplant, and that's why I'm here. I read the story about her nephew and what he enjoys doing, and I just felt called to help. I cannot tell you how common that almost exact exchange is. So the tricky thing with social media is you can't really tell how many people you're reaching, right? So you can't tell how many people have seen it, but the effort and the work that goes into it does reach a great deal of people. And asking your friends and family to share that as far and wide as they're willing is kind of the key to reaching that big audience. So we kind of touched for a brief moment on the finances, but I think it's important we talk a little bit more about the living donor and if they have any out-of-pocket expenses. It does vary case by case and could include lost wages, travel expenses, and childcare costs. The National Organ Transplant Act allows for the recipient to pay for their living donor's travel and housing in connection with their donation. So, for instance, if you live in South Carolina and your donor lives in Florida, the recipient is allowed to pay for their living donor's travel. Not everyone has the means to do that, and we'll get to some assistance about that in just a moment. The transplant hospital financial coordinator, just like they meet with the recipient during their evaluation, they also meet with the donor. And part of the thing they'll do is look at the recipient's insurance policy and see if their insurance covers a travel benefit. And so that's something that helps also, is if the intended recipient, if their insurance has a travel benefit, the donor can use that, which is really nice. Also, there are organizations that provide financial resources to living donors for uncovered costs. Probably the one we think about most commonly is National Living Donor Assistance Center, and we'll talk about that one in just a second. And it's important to check in with your transplant hospital. Some transplant hospitals have resources such as lodging and things like this. And usually those are pretty easy to, if your hospital has resources like that, they can access those. My dog just opened the door. So the National Living Donor Assistance Center is, again, the most common place where people receive assistance. So this is an application that you would just fill out with your transplant center. If you are donating or if you are a recipient, both of you have to provide information. If you're donating anonymously or altruistically, you are automatically qualified for this assistance. So they will give you assistance up to $6,000 for travel, lodging, and other expenses. So they are actually, because the recipient is able to pay, or I should say is allowed to pay for the donor's expenses related to those things we discussed, then it's the recipient's income that's looked at for the comparison. So for instance, if you're a household of 4 and you're living in Utah, then if your household brings in less than 105,000, then your donor would be eligible to receive assistance. Similarly, if you're a single person, it's that $51,000. So 300% of the federal poverty level is the calculation they use. So they do update this annually when the poverty statistics come out. This just kind of automatically updates. If you are declined assistance from them, they can also kind of point you in the right direction based on needs and region. A good resource for those seeking financial assistance. It's really great. So kind of like we touched on how to apply, the donor and the recipient enter application information online or in paper worksheets to their transplant center. The transplant center checks and submits the application, and then the donors are approved, and then they're provided either reimbursement or usually the travel money. It comes on just like a prepaid little credit card. And then again, lost wages and dependent care reimbursements are sent by direct deposit or check. So they just pay you directly. Oh, excuse me, I skipped one. And then kind of to that end, we're going to talk a little bit more about fundraising resources. Help Hope Live is a really wonderful fundraising resource. Funds raised can be used for donor expenses as well as the recipient's expenses. So if you are fundraising, let's say for your surgery, and you're using Help Hope Live, both parties can access those funds. And then of course, the National Foundation for Transplants, funds can be raised and used for the donor and recipient's expenses. They're launching a new and exciting program that will allow living donors to kind of do their own fundraising campaign. And then, of course, the Children's Organ Transplant Association, or CODA. We have the website on there. This is a really wonderful organization that helps transplant recipients who are, and also adults, that it started with the childhood disease. So if you have a congenital disease or I think it says a single gene mutation, then you are able to apply regardless of age. And so they will help you do fundraising, and they do a wonderful job. Potential benefits of fundraising through these types of nonprofit organization are the funds raised are not considered taxable. So if you're worried that this would jeopardize your disability income or anything like that, it is not, it's not able to do that. The fundraising process is very transparent. People feel really comfortable donating to something like that, rather than some people are uncomfortable with donating to like a GoFundMe or something because they're not necessarily guaranteed where that money will go. And then a mechanism is already in place for use of excess funds. Every organization has their own way of doing that, whether it's rolling it over into a larger fund, or kind of dog-earing it for future medical expenses. As we know with transplant, the medical expenses are kind of ongoing in nature, and so it's not uncommon to use that money later down the road. Potential pitfalls of fundraising through a nonprofit organization. It is pretty restrictive. It's really only for those expenses that are approved. The effort has to be connected to the intended recipient's fundraising profile. So that's why they're coming up with this other way that, donors can kind of fundraise on their own for themselves, which is really good. And then kind of looking ahead at the living donor legislation, there's a lot of interesting stuff going on right now in the legal world. Kind of dry but important. Donor leave laws. Employees of the federal government receive 30 days paid leave for organ donation and 7 days for bone marrow donation. This is also becoming very common at large employers. So if you work for a large corporation, please inquire if this is a benefit that you may have. And if it's not, then inquire why it's not. A friend of mine works for a large clothing company, and their head of HR donated an organ to someone. And then through her donating, she realized, well, this doesn't really count for like sick leave the way I thought it would. So she made sure that their company changed their policy, and many companies are doing this. If you work for a hospital or healthcare corporation or insurance company, make sure you're asking if you're wondering if your insurance covers something like that. And then there is also some pending legislation regarding a tax credit, provide a federal tax credit up to $5,000 for unreimbursed expenses, including lost wages for living donors, for kidney, liver, lung, pancreas, intestine, or bone marrow. So this legislation is not yet passed, but you can always contact your representative about it. And then in April, the Living Donor Protection Act of 2023 was introduced. And that would do 3 different things. One, it would prohibit life, disability, and long-term care insurance companies from denying or limiting coverage. Once someone has been a living donor, they can be denied life insurance coverage, disability, or long-term care, or those things can be made just like exponentially expensive. So they're really unattainable. So the legislation is hoping to address that. Also clarify that living organ donors may use their Family Medical Leave Act time to recover. Family Medical Leave Act is something that is an employee benefit for people who work for a company with over 100 people. You have to be a full-time employee for more than 1 year to access those benefits. Very simply, what it does is protects you from being fired, or for your job being for you being replaced in your absence if you're recovering from illness. Many people think of this as kind of what moms use during maternity leave. So again, it doesn't guarantee any income, but it does guarantee that your employer cannot terminate your employment if you are a living donor. And so FMLA typically covers up to 1 year of absence from work. Or 12 weeks of absence from work. And then again, they want to direct the Department of Health and Human Services to update the materials on living donation to reflect the new protections and encourage more individuals to consider donating an organ. I briefly wanted to show you all my citations and then invite you to keep an eye out. This is going to be the first in our series of Living Donor Talks. The next one will be in August with a date yet to be determined. And we will be discussing, I think we're going to call it Transplant or Living Donor 101. We have a Transplant 101 presentation in our archives, and you can access that. And the Living Donor 101 is going to kind of go from start to finish from the living donor's perspective. So that will be more of a panel discussion with living donors of both liver, kidney. We're currently trying to rope in a surgeon or two and some other people that can share their unique insight and perspective, including a living donor coordinator who is kind of the air traffic controller of the living donor experience. So I want to take a moment to thank you all for spending time with me tonight. I appreciate it. And if you have any questions or concerns, please feel free to reach out. You can find more information about Gift of Life at giftdonor.org. Thank you.